Hi, Russ again here, and I guess maybe just to recap, my first video I just talked about, why did I decide to make a video, and I guess maybe the highlights of the things that I've learned going through this whole process. So just to get into why I chose surgery, 55, as best I know, my issues, the issues that I had were all related to nerve pain. I know it now to be nerve pain, but that was my shoulder. I would have tremendous pain in my right shoulder. Started happening about 11 years ago. I've had a lot of issues on this side of my body. I had a broken collarbone, a dislocated, not dislocated, but complete AC joint separation. So this is kind of my happy side of the body. And I started about 11 years ago. I mean, I would literally, if I turned around and saw a pair of vice grips on the end of my shoulder clamped, I wouldn't have been surprised. It's exactly what it felt like. The first couple of times it happened, I was like, what on earth is this? I think I mentioned in my first video, my carrier at the time went to see the doctor. Doctor said, you have stenosis. Kind of like, tough luck, bud. And I wish I had pursued it then. Didn't recommend PT, didn't recommend anything, just such is life type of an attitude. And it kind of would come and go. And it would kind of go away for no reason. I would all of a sudden, hey, come think of it, my shoulder and neck haven't hurt me in a while. Excuse me. What I did end up finding out is stress definitely seemed to bring it on. Anytime I was under stress, pain would always intensify. It definitely seemed to be related to work. I work at a desk, but still, kind of went back and forth. Do I have a shoulder problem? Do I have a nerve problem? When I finally did start to see doctors, the first doctor I saw was a guy was awesome, great doctor, and I don't think it's appropriate to say my doctor's names per se. I don't know that they would necessarily want me to speak on their behalf, so I'll just leave that out. But he was with I think it was called Regenerative Sports Medicine. So he was extremely thorough, excellent communicator, gave me referrals to all different doctors, orthopedic, spine and neck and spine health doctor, who they gave me shots where they would put the cortisone shot actually in just below where the trauma is, or where the issue is, see if that would help. I had several different cortisone shots in my shoulder, and again, none of these seemed to help. The sports regenerative medicine doctor, he wanted me to explore getting, and I'm not going to remember the names of what they are, but it's a cocktail of something that heals your own body. There are a lot of people who've had great results with things like that. A lot of athletes use this. I just felt like, it wasn't covered by my insurance. The most expensive one was going to be $2,500 a pop, and it was going to be easily 4 to 5 shots to find out, hey, it worked or it didn't. I didn't really want to go down that path, and I still didn't. I wasn't convinced. The guy was fine, but again, he sent me to different places. As I said, I had cortisone shots, different places in the shoulder, in the spine. Anytime you get a cortisone shot, apparently it's got, I think it's lidocaine in it, which I think is what football players take so they can play when they're hurt. So it would feel great for a while. My gosh, first time they gave me a shot in my shoulder, I felt like a new man, but it didn't last very long. And again, it kind of would come and go. So I mentioned when I first had it was about 11 years back. What really prompted me to start seeing a doctor, I should have backed up and said, was about 2 summers ago, all of a sudden I started to get like the whole back of my shoulder would just go numb. It kind of freaked me out. I mean, it would, like, you could have probably stuck a pin in it and I wouldn't feel it. Wouldn't necessarily last long, but it was just like, wow, this seems like something different. A lot of times people with stenosis, you'll get tingling down your arm. I wouldn't get that very often. However, as a kid, I played football, and I could easily get a pinched nerve and a stinger. Anybody who played football knows what a stinger is. And to the, well, hopefully not to this day, but prior to my surgery, I could push my head into a particular spot and I could make that nerve fire. So I always felt in the back of my mind that I had some kind of a nerve issue. So once I kind of like had narrowed it down, I got recommendations on 2 different neurosurgeons. The first neurosurgeon I met with, one thing that was really cool is he took my MRI and he said, "I'll tell you why you have pain." And he showed me right on it. Said, "Look, this is a healthy exit of between the vertebrae of your nerve coming out where you don't have pain." And, not to scale, but let's say that would have been the size of my thumb. And he said, "And now these are the degenerative areas where you have stenosis," and it was more like the size of my pinky. So you could see, maybe not that extreme, but a good, I would say 30 to 40% where that nerve was being constricted. So again, I felt pretty confident, yes, this has got to be a nerve problem. I should back up one thing. Through the course of this, I did see an orthopedic surgeon about my shoulder. They did an MRI on my shoulder. Lo and behold, I have tears in my shoulder. But newsflash, if you're a 55-year-old man, you probably have tears in your shoulder. And that's basically what the guy said. He said, "Look, I could go in there and sew some stuff up." He said, "I don't think it's your problem. Best I can tell, most guys your age have it." He said, "I don't think it's your problem." So anyway, I thought I would just mention that. I even visited having that surgery. Anyway, getting back to the neurosurgeon. So the first neurosurgeon I saw said, "Pretty clear, I know why you're having pain." He recommended the ACDF surgery. He wanted to do 3 fusions, which would have been C4 to C5, C5 to C6, C6 to C7. I had heard that he was highly recommended. I had heard that there was another neurosurgeon that was even more highly recommended, but at the time the referring doctor said, "You probably won't get into him, he's that good." I was able to get an appointment with him. Pretty much very similar discussion, told me the same thing, and then said that he didn't recommend doing 3, he wanted to do 2 levels. So rather than fuse C4 to C5, he was only going to do 5 to 6 and 6 to 7. So that was a big difference, and I kind of was going back and forth, but I chose the second doctor, the one with what I would say the less aggressive approach. And by the way, if you're considering ACDF surgery, if I'm not mistaken, I believe this is the most controversial part about the surgery. Is what the concern is that once you fuse, once you have a problem area and you fuse these together, you're never going to have a problem there where it's fused. However, if you have a marginal, a compromised vertebrae or joint on either side of where you fuse it, now you put all the pressure there. So that's pretty much as I understand it, it's the most kind of, you'll get different opinions from different doctors is what I think I'm trying to say. The doctor I chose, he said that he felt like he gets better results being a little less aggressive, fusing less, but focusing on strengthening the neck area to support the because I definitely have a little bit of a compromise in the C4 to C5. And so he had told me all of this prior to the surgery. Interestingly enough, we didn't have this discussion, but the day of the surgery, I had a bit of anxiety, and I guess I kept thinking, what if he doesn't fuse that one and I have a problem later, then they got to go back in. But he mentioned something which made a lot of sense to me. He said, look, if I fuse all three now, and then later you have a problem on either end, and would probably more likely be lower, I'm not sure. He said, now, if that scenario plays out, you have a compromised area, it's exacerbated because you fused around it. Now you went from a 3 level to a 4 level. And the way he explained it to me is, even for a young, healthy person with good mobility, I think if you fuse one disc, it's almost imperceptible. Again, I'm not a doctor, do your own research, but this is what I gather he said. When somebody my age, especially when you've had a problem long enough, you've already lost mobility, whether you know it or not. So when you get to 3 levels, most people notice a difference in mobility. And again, a young person, who would have to have such a surgery, they would definitely, but as you get older, you have less mobility anyway. So again, I went with the second doctor, the doctor who recommended doing the 2, and that's what I went forward with. 2 big questions people have been asking me. Was my surgery voluntary? Both doctors actually described it the same. They said that, believe it or not, actually, a lot of people will come into their office and they will have lost mobility because of stenosis or trauma to a degenerative disc, whatever it is, and they will just work around it, and they don't, I guess maybe in some cases they might not have pain the way I had pain, but they'll just start things they used to do. If it was on their left side, they'll just start doing it with their right side, and vice versa. So in my case, there didn't seem to be any perceptible loss of function. My case was pretty much just centered around pain, discomfort, and pretty much pain and discomfort. But both doctors said it's probably a matter of time. Maybe I'd be 60, 65, 70. He said sooner or later, there's more than likely you're going to lose mobility. You're going to lose something, and at that point, it is definitely not an option. You would need to get it done. So it basically came down to, what is your level of discomfort? Are you able to manage the pain? Are there other treatments that you can do to help? So again, I bring all this up just because maybe this will be the case you're in. I had tried physical therapy. I guess I even tried dry needling, which is a little different than acupuncture. I never did try acupuncture. As I said, I tried various cortisone shots. I tried different things of that nature. I was prescribed Lyrica, and I went off Lyrica and went on to gabapentin, and they're very similar. Gabapentin is, I think, kind of a less expensive version of Lyrica. I believe they do about the same thing. I never really felt like any of those helped. At one phase, I really thought physical therapy was making a difference. I was kind of like, I'd been in a lot of pain. Pain was getting better. But one day I just, went to physical therapy, and I was just in agony. It was as if, nothing, anything that I thought was a gain was just completely, went backwards. So I just personally got to the point, and both doctors said, hey, if you were coming to me as your first, the first doctor you saw, I would never recommend surgery. However, having done, all of the various things, medications, shots, etc., and the fact that you're not able to there's nothing that's controlling your nerve pain, they both felt it was an appropriate option. They said you could choose not to do it and wait, but it was an appropriate option. Obviously, I chose to do it. And again, you know, see your doctor, get multiple recommendations. And I like I said, I mean, it's not doctors that you're going to see out on YouTube, but it is interesting to hear kind of other people's stories, see if someone else's story sounds like yours. Perhaps my story sounds something like yours, and it will be of help. But I'll end this now, and then I'll just get into kind of the day of the surgery on up until this point. See you in a minute.